you feeling today? Okay. Yeah, I was just looking at your chart and seeing that you're having something going on with your throat. Okay. How long has this been bothering you? A couple weeks. Okay. And before we get started with the exam, just so I know what all I should be looking into, have you had any accompanying symptoms such as a fever, headache, nausea, diarrhea, any sort of sensation in your ears, pain in your teeth? Okay. All right. So headaches, tooth pain, and fever. Okay. All right. And is there anything else that you're going to want for us to discuss today? Okay. So we'll just go through a few things. I'm just going to sanitize my hands here. And we'll try to figure out what the problem is, okay? All right. Do you kind of recall how this all started? Okay. Okay. All right. So I'm going to look at your teeth first and see if there are any obvious signs of cavities, tooth decay, anything wrong with your gums. And also I'll check your back teeth to see if any of your actual tooth structure has maybe broken. Sometimes people get a chip and they don't even realize it. So, all right, so if I can get you to give me an ah and just try to keep your tongue relaxed, okay? All right, I'm going to start at the top and the back. I'm just gonna pull on your cheek here a little bit. Sorry, I know it's not super comfortable. Okay, go look at the bottom teeth. Okay, I'm gonna switch to the other side. Give me a second to swallow there. Okay, let's see here. Pull the cheek out. Okay, let me get back into the bottom there. Okay. All right, can you give me a big smile? Okay. There are 2 teeth in the back that I'm going to check. This is a sharp little hook here that I'm just going to tap into your tooth. And if it gives kind of a sticky feeling, that will let me know that we've got a little bit of decay happening. One of these teeth looks like it already has a filling, so sometimes you need to get your fillings refilled. They don't last forever, unfortunately, but hopefully we'll just get a more of a solid kind of sensation and sound. And if that's the case, then these teeth aren't a problem. Okay, so I'm going to pull your cheek out this way, okay? And I'm gonna go in here. Okay. The back one. Okay, those actually felt fine. I'm not concerned that you have any substantial decay, and those were the only teeth that looked like they might be posing a problem. Your gums look healthy, so I'm not super concerned or suspicious about your teeth. So the next thing I'm gonna do is actually look into your ears, okay? Ear, nose, throat are all connected, of course, so sometimes when you have symptoms in one, they could be coming from another. Okay, so I'm just gonna look into your ear here, and I'm gonna pull your ear a little bit. Okay. And I'm gonna do the same on the other side, okay? So we're just gonna look, and I'm gonna pull. Okay. Your ears look pretty good too. I'm just gonna feel around them if that's okay. Any pain anywhere, tenderness? No? Okay, I'm gonna tug your earlobes down. Feels okay? All right, and then I'm gonna pull the cartilage out. Does that feel all right as well? Okay. I don't see any signs of an infection in your ears. Your ear canals are looking clean and healthy. Nothing looks red or inflamed. Your eardrums look good. Okay, and then on the outside, all of your cartilage is not having any sort of sensation problems, it seems. So, yeah, sometimes you can get like a weird full sensation or some crackling. Haven't been having those though. Okay. Okay. Let's see. I'm also just gonna take a quick peek inside your nose. If you could tilt your head back just a little for me. Other nostril. Take a deep breath in for me through your nose. One more time. Good. And I'm gonna look once more. Other side. Okay. Your nasal passages look great. They responded as expected when taking a nice deep inhale. I didn't see any redness or excess mucus or anything, kind of lining your nasal passages. Okay, so that's great as well. So now I think what I'm gonna do next is just kind of feel around. Okay. So I'm gonna start at the back angle of your jaw. And I'll just kind of slowly work my way up, and you just let me know if any of these points feel tender or uncomfortable or just different than you would expect. Okay, get your chin here. all of this along your jawline feel okay? Okay, I'm gonna feel around your throat now. I know this is kind of a little vulnerable, but if you could just kind of sit still for me, breathe normally, or however you feel comfortable. I'm gonna do right up into your gland area here, one side at a time. Okay, and the other side. Okay, those are feeling pretty equal. They don't feel particularly large to me. Okay, and none of the area around your throat that I was feeling was painful at all. Okay, the next thing I'm going to do is push down on your trapezius muscles, your upper trapezius. So that's the kind of triangle here. This is part of it at least, above your collarbone. So you've got in here your ribs, your first ribs, and then behind this kind of meaty part is your upper trap. So sometimes when this muscle gets tight, it can cause problems from the neck up, if not also from the neck down. So I'm going to press and just let me know if they feel tender at all on either side, or if there's any spot that I press that gives you any sort of referred sensation. Do you know what that means? Yeah, so it can be anything like tingling, burning, you can get like a cold sensation, you can get like a headache sensation, you might get some pain elsewhere in your head or around your scalp, okay? It's nothing that you can't, handle, it's just you'll notice it, okay? All right, so I'm gonna start over here and I'm just gonna press down, okay? Right about there. And where's that referring to? Forehead. Okay. And that's your left. All right, I'm gonna finish on this side. I'm gonna press down again. There. Okay, just kind of hurts in that area. Okay. We call that local. Okay. I'm gonna do the other side, same thing. So I'm just gonna press into this trap muscle. Right there. Is that worse than the other two? Okay. And you feel that kind of coming down your back? Okay. And let's see. Any other spots on this side? No? Okay, great. So did any of those spots that were painful for you feel or cause a sensation similar to the pain that you've been feeling or the discomfort? Okay, there's another muscle that I'd like to check. It's called the sternocleidomastoid, which is just based on the areas that it connects. So it comes to your sternum right around here. So that's the sterno part. Cleido, it has another strand that comes and connects on your clavicle. And then your mastoid process is kind of behind the ear here, and it helps you chew. So if you kind of feel around, put your hand behind your ear and do a chewing motion, you'll be able to feel some activity back here behind the ear, okay? So sometimes when our jaw gets tight or our neck gets tight, it can also affect the other one. and that can actually cause tooth pain. You can feel like you have a cavity or a sore tooth, infection, even sensation, but truly it could be from tight muscles. Yeah, I know, it's very weird. So the sternocleidomastoid is this ropey muscle here, and this is the sternal head, and then there's another one behind it that goes down to the clavicle. Okay, so what I'm going to get you to do, you can see how when I turn my head it kind of pops out. Okay, so I'm going to get you to turn your head for me, and I'm going to take my 2 fingers here, and I'm just going to kind of do small little movements from the bottom to the top. Okay, I'm only going to be focusing on the head that, let me say, the part of the muscle that we can see right here. The other one's a little deeper, and although it can be in play, and typically is, usually you'll have whatever side effects or symptoms, whatever you want to call them, that you're having from the sternal head. So we should be able to tell just by kind of palpating these parts of the muscle if it's a part of the problem. Okay, so let me get you to turn your head. All right, I'm just going to make my way up. I'm going to feel behind your ear. And I'm going to come down and feel right around that sternum area. Okay, any pain? Yeah, okay. I'm trying to be gentle. Let me get you to turn the other way now. And I'm going to feel behind your ear. And down at your sternum on this side. Painful on that side. Okay, okay. All right. I'm trying to think if there are any other muscles that I'd like to check. I think I'm just going to feel around your cheekbone area here. So that mastoid process, the masseter muscle is the one in the front that helps you chew, and your cheeks. So a lot of us don't really think about the muscles in our face and scalp and cheeks, but they're there. And this one connects partially right along your zygoma, your cheekbone as we call it. So I'm going to take my finger, find the bottom of that cheekbone, and just make a little circle, and then I'll move to the next spot. Now I am going to try to use gentle pressure, because in the event that this is sore, it can feel really sore really fast with very little pressure. So I'll do this on both sides, okay? So just kind of relax. You don't have to do anything in particular. All right. Feeling it already. Okay. Yep. Okay, let me see the other side. Painful. Okay. All right, so this all being the case, I am going to recommend that you actually go get a massage. The massage is going to concentrate on some of your neck and back muscles, as well as doing a TMJ massage, which will happen both on the outside and the inside of your mouth. So your massage therapist will put some gloves on and work from the inside. And even though it sounds weird, that part is honestly one of the best things for pain in this area. It's the most effective thing that I've ever found, and it can really save you from a lot of discomfort, as well as any chance of needing surgery in the future, even lockjaw in the future. You can end up having a situation where the joint gets out of whack to the point where your jaw gets stuck either closed or open, depending on what you were doing when it happened. Yeah, it's not fun. Okay, so having these tight neck and jaw muscles, and even muscles of the scalp, can really snowball into something unpleasant over time if not taken care of. So I'm gonna send you to a friend of mine who is a great massage therapist, and she specializes actually in TMJ massage as well. So I'm going to recommend that you do a 2-hour session with her, and this can be billed through insurance or an HSA, since it is a prescriptive massage for all intents and purposes. And I'm gonna send you with some, this is my big one, but I'm gonna send you with a smaller container of this sore loser, it's called. And this has a bit of a grippy texture to it, but it's also meant to soothe sore muscles. So it will be helpful in calming all of this down. Another thing that I'm going to recommend is that you alternate cold and hot around your neck and or jaw on days that you're feeling particularly sensitive, or if you feel like things are tightening back up. Even if you're just having a stressful week ahead, it's good to preemptively do this. So you can take a washcloth and wet it, and you can heat it up just in the microwave and use that. Same thing, you can use an ice pack, or sometimes they have like jelly bead wraps that you can just put in the fridge so they're not as harsh as something in the freezer. And then just do maybe like 10 minutes of heat, 10 minutes of cold, and alternate back and forth. You can even just do 5 minutes, or maybe you want to alternate every 3 minutes, but just make sure that your product that you're using to do that is hot and cool at least every time that you're cycling. Okay. What that does is, on a cellular level, it kind of pumps the cells so that they are forced to clean themselves, essentially, get rid of any waste, and that can help with inflammation and just getting your body back to a comfortable place. Okay. All right. Is there a certain time of day or day of the week that's best for the massage therapist to call you to set up your appointment? Okay. She usually keeps 1 or 2 slots open a week for when doctors send patients her way. So she should have something within the next week or so, as long as she's not being inundated currently with other clients. Okay, great. So I've written a note to the front desk to send you with a sample of this. It's more of a prescription than whatever the standard therapist will have. So, okay. Let's see. I don't think there's anything else I need from you. Is there anything else, any questions that you had, or? Yeah, so after one massage, it varies from person to person. Sometimes people feel a little sore the next day. Sometimes people feel great right away. It just kind of depends on how you take care of your body before and after the massage. How healthy you are in general can kind of help with the recovery process. And after one massage, whenever you end up not feeling sore, you should feel much better. Sometimes the symptoms that you've been feeling will alleviate completely. The thing is that we're not really getting to the root of the problem, which would be whatever's causing that tension in the first place. So I always recommend that you kind of take a little inventory of your current life situation and try to reduce whatever might be impacting how much stress, tension, clenching, grinding that you have, and making that more of a lifestyle change, as they say, so that you don't have to get massages all the time in order to maintain a more comfortable body. Okay. All right. So for now, you can take some Tylenol or some other kind of anti-inflammatory that can sometimes help. But I would just get in that massage sooner than later. And I'm sure the therapist will also have some tips and tricks for you. And I would just make sure that you really pay attention to those and follow them if you want to alleviate this in the long term. Okay? All right. Well, it was good to see you. I'm glad that this is a muscular issue and we don't need to pull any teeth or have anything major happen. Okay. All right. Just sent that to the reception, so you are ready to go.